This is Dr. Naaz, and today we are going to talk anemia second part. Anemia is the reduction in the oxygen carrying capacity of the blood. This oxygen carrying capacity is being reduced due to reduction in either of hemoglobin or RBC or in hematocrit value or PCV. So the normal hemoglobin ranges in men it is 13 to 17 per dl, in women it is 12 to 15, and in children it is 11 to 13. So what is the basic of anemia? First, before defining the classifying the types, I would like to discuss about the RBC indices. The first one is MCV. What is MCV? MCV denotes the size of hemoglobin. The normal range is 80 to 100. So if it is below 80, it is known as microcytosis. If it is above 100, it is known as macrocytic. Now coming to the second one, MCH. MCH means average hemoglobin in single RBC. So it is normally 27 to 33 pg. If it is less, it is known as reduction in MCH, hypochromic, and if it is more, it become hyperchromic. MCHC, that is average hemoglobin per hemoglobin concentration. That was hemoglobin in single cell. This is concentrated cell per dl concentration in RBC. The normal range is 32 to 36. So below and above will make the difference. Before going forward toward it, I want to have a quick recap of reticulocytic index. What is reticulocyte? These are immature hemoglobin. These are found when the hemoglobin is being produced, hemopoiesis. So the normal range of reticulocyte index is 0.1 to 1.5. If it is more than 2 and if it is less than this normal range, they make a difference. Reticulocyte index is calculated by patient HCT, hematocrit value by normal HCT. So mostly when reticulocytes are increased, it is like there is anemia with high reticulocytic index. It is mostly when the marrow is healthy, when the bone marrow is healthy. This is seen in hemolysis when the cause is not in the bone marrow. But when it is less, it is reduced, then it is maybe due to when there is marrow failure. Do you know an example of marrow failure anemia? That is aplastic anemia, right? Aplastic anemia is one such variety. Now coming to the classification, as I said, the first one will be when the MCV, MCH and everything is down. So there will be microcytic, hypochromic anemia. What happened here? What will happen to MCV and what will happen to MCH and what will happen to MCHC? All will be reduced the normal range. Few causes of this. So here the cause lies in iron deficiency anemia, thalassemia, sideroblastic anemia. Sideroblastic anemia is defect in hemoglobin synthesis. Thalassemia is due to genetic defect in globin chain. Iron deficiency is the one which is very popular all over the world. Anemia of chronic disease. Sometime it will show microcytosis. So here one quick question, out of which in which kind of anemia you get this cell, target cell? It is found in thalassemia. Now coming to the range where everything is normal, normocytic, normochromic, anemia means when there is MCV, MCH, MCHC, all are normal. The common cause will be, of course, in the bone marrow, aplastic anemia, in bone marrow failure due to radiation or viral effect. Second will be hemolytic, when there is sudden loss of a hemolytic. Then there is premature RBC destruction, when there is hereditary spherocytosis, G6PD deficiency, sickle cell anemia, or any acute blood loss. Suppose there is a trauma or GI bleeding. Here one of the most important thing to come to conclusion, we have to check reticulocyte index. Now coming to macrocytic normochromic anemia. Macrocytic, what I said earlier, when it is the level is more than 100, right? So the MCV, MCH may be normal or increased. These things are there because cell are large, no? So this can be normal or increased. Now the causes of this macrocytic anemia, first one will be megaloblastic anemia. Megaloblastic is one common factor. What happened in megaloblastic anemia? It is due to which deficiency? Vitamin B12 deficiency or folate deficiency. Pernicious anemia is an autoimmune cause of vitamin B12 deficiency. It is intrinsic factor, antibodies are there, because of that pernicious anemia is one variant. Coming to liver disease. Alcoholism. In alcoholism also there will be this myelodysplastic syndrome. Myelodysplastic syndrome. So in macrocytic anemia, you will get the neutrophils which are there. They will be hyper segmented, macro ovulated sites, or hyper segmented neutrophil will be there, no? Neutrophil. So this is about a different type based on the morphology. In the next part we will discuss about etiology classification, because based on the causes we can also classify it on it.